it's a retrospective, a small sample pilot study, but it has a very interesting result, so I'd like to share it with you. It's on post-operative radiotherapy in T4 melanoma patients and how the treatment outcome is compared to the control groups. Traditionally, radiation treatment in melanoma has been highly controversial, and there has been no standardized protocol and for the post-op adjuvant radiotherapy for primary melanoma tumors. And most existing guidelines emphasize individualized treatment. So it's quite skeptical. And our objective was to evaluate the clinical benefit of post-op radiotherapy in T4 primary malignant melanomas. So we retrospectively reviewed 27 patients with T4 melanomas, and among those 27 patients, 12 underwent post-op radiation treatment, and 15 who did not were used as controls. And we used all these factors for multivariate Cox proportional hazard model analysis. And we also analyzed 1-year recurrence-free survival using Kaplan-Meier's graph.
Yeah, so thanks again for this opportunity, Patrick, and everybody else, and Dr. JAMORA. So we are barely 200 days to the WCD, and so I thought I'd give you a quick update of what we've been doing so far. As you know, this is the first time that it's coming to our part of the world, which is Southeast Asia or even South Asia. It's a great honor that we were picked. This is our organizing committee. Many of you would know, obviously you know Chiliok. The Secretary General is Yen Lu. I think some of you will know her as well. And then the other people there, we've got Dr. T. Shang Yen is our treasurer, and we've got 3 vice presidents and a whole string of other organizing committees. It takes quite a big group to do this meeting. Bit about the Congress venue. The Congress venue is going to be in the Suntec Convention and Exhibition Center, which is very much in the middle of town.
Among these key points, I think the most important one is the long-lasting radial growth phase, especially in acral lentiginous melanoma. So we need to know the long-lasting time. At that time, what should I do? Because it's a long-lasting, actually more than 6 months or 1 year later, the delayed diagnosis and the death rates are higher. So the melanoma actually devastating, actually the unnoticed longer. So early detection and monitoring the lesion for changes can be life-saving. A recent paper also studied about the treatment delay. And then they shows the patients with stage 1 disease suffer significantly worsened melanoma specific and overall mortality rate. So our realistic strategy is to educate the dermatologist with dermoscopic examination in early detection,
Where they had found out that patients with early stage, specifically stage 2B and C, I think those are patients with a T lesion of 2 to 4 millimeters with ulceration, or I think the C is in patients with greater than 4 millimeters. Today, even in node-negative patients, that study where they enrolled 700, I think a big number of 900 patients, the results turned out that patients who received 1 year of pembrolizumab dosed at 200 milligrams every 3 weeks for 18 treatments, did better with regards to relapse-free survival and distant metastatic survival. So now we're going to become even more busier because we have moved the role of immunotherapy now no longer limited to the metastatic stage, but even in patients with stage 2B and C. And if we were to put this together with the lecture that Dr. Chung shared with us today, then it begs asking the question,